Actus. I am an MSN student and my concentration is in nursing leadership. I am going to be speaking to you about my emerging technology about lenacapavir, which is an HIV prevention medication that is given biannually. First of all, I'm going to speak to you about HIV/AIDS, since this is the virus and the disease process that this medication is focusing on. This is what I'm going to speak to you about. Research in understanding the virus began in the 1980s. In the 1990s, there was still a huge misunderstanding of the way that it was spread and how to treat those with the infection. In the 1980s and 90s, it was almost a death sentence for those who were diagnosed with HIV/AIDS. In 1987, the first medication used to help those infected with HIV was AZT, and that's actually a medication used to treat cancer. In the mid 90s, what is known as the cocktail was frequently given to those diagnosed with HIV. And research continued and bringing us to present day, and now we have an injectable HIV prevention medication. Gilead Sciences is the corporation that has funded this research and has founded that we needed a medication that was easier to transport and to give biannually and not require in daily medication. So first, let's talk about the first oral HIV prevention medication, which is Truvada, and that was approved by the FDA in 2012. Those who had that medication were frequently gay men who tested negative for HIV and AIDS, and they also had to frequently have their blood work checked besides just for HIV. They had to have their kidney functions checked pretty frequently. Research for longer lasting injectable HIV medication prevention began in 2018. Lenacapavir is a prophylactic, long acting injectable, and it requires administration biannually. Lenacapavir functions by inhibiting the formation of protective complexes around the RNA, thereby preventing viral replication and potential transmission. Several human trials showed the success of biannual lenacapavir, and there is research on going for annual lenacapavir injections. Twice yearly lenacapavir for HIV prevention in men and gender diverse persons. This is one of the papers that I read while doing this study for the emerging technology. So this is phase 3 of the research process. Research assessed the effectiveness of lenacapavir in cisgender, transgender, and non-binary genders. The study took place from June 28 of 2021 to December 12th of 2023. To participate, the individual must have tested negative for HIV. It was a double-blind study with 3,265 participants. It was a 2-to-1 ratio receiving the lenacapavir injection. And as you can see, it was this study was around the world. It was 92 different clinical sites. So it was divided 61 clinics in the United States, 9 in Brazil, 7 in Thailand, 6 in South Africa, 5 in Peru, 3 in Argentina, and finally 1 in Mexico. The results of this showed significant decrease in the incidence of transmission for all genders that received the lenacapavir injection. This study was specifically for cisgender women. As you recall, when I mentioned the Truvada oral medication, it was primarily given to gay men. So this study focused on women and adolescent girls, and this focused on those in Africa, South Africa, and Uganda. So this was also phase 3 of the research process, and the research assessed the effectiveness of lenacapavir in cisgender and adolescent young women. To participate, the individual must have tested negative for HIV. It was a double-blind study with 5,338 participants. It was a 2-to-1 ratio receiving the lenacapavir injection along with the daily oral medication. As I mentioned prior, the study took place in South Africa and Uganda. No participant that received the lenacapavir injection during this study became infected with HIV. And according to the author, the HIV incident rate substantially decreased during this study. The FDA approved the lenacapavir injection for biannual use in June of 2025, and that was for public use, so there is options available. The medication is still very expensive, and it's also difficult to access. From what I understand, still are some providers that either do not have it or they don't know if the pharmacy that they normally use has it available that they can give it to their patients. Recent decreasing of HIV research from the federal government, reducing DEI initiatives slows programs for furthering of the science regarding HIV and AIDS. Researchers are hopeful with furthering testing and make HIV prevention medications more accessible. These are all my references. I hope you liked my emerging technology, and I look forward to seeing all of yours. Thank you.